Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California. And today I want to talk about the possibility of non-surgical or minimally invasive buccal fat pad removal. This is something that a lot of people ask me about. Can it be non-surgical? Can you do Kybella? Can you use FaceTite? Can you use AccuTite? Can you use liposuction? What can you do that's non-surgical? Of everything that I just mentioned, Kybella is non-surgical, but everything else truly is surgical. So buccal fat pad reduction and removal is an inherently surgical procedure. And I'm going to talk about the feasibility of using radiofrequency energy in the form of FaceTite or AccuTite to remove or reduce this fat pad, because it seems pretty ideal. Less scars, even though they're internal. Less risk. It seems like a good win-win situation, doesn't it? Maybe not. I've brought my friend Yorick here today as a demonstration of the possibility of what buccal fat pad removal without a knife might entail. I've seen videos on YouTube when you Google non-surgical buccal fat pad removal where physicians, MDs, are using radiofrequency bipolar probes to smoothen the area over the buccal space to reduce the buccal fat pad. Unfortunately, I don't think that is a possibility. And I think when you are using these sort of technologies, as I often do, you're only addressing the subcutaneous fat and not necessarily the buccal fat pad that lies below. Everybody, this is how big a human skull is, a full-size adult human skull. And the buccal fat pad really kind of lives in this space right here. And so when we say it's the size of our thumb, the buccal fat pad's the size of the thumb, we're not kidding. I mean, that really is assuming most of this volume. And it starts in your cheek and it goes all the way up to the temples. And when you push it, you can see it sort of slowly push in and then slowly fill back in again. Here's a good drawing that I found online. I don't own rights to it, showing the size of the buccal fat pad in its entirety with relation to the human skull. So today for this video, I would like to dispel any myth that non-surgical or minimally invasive buccal fat pad surgery is doable or even safe. So for the first part of this video, I would like to show you a time lapse of what happens when I directly energize or add energy to the buccal fat pad with FaceTite, which is a pretty hardy probe. And I am literally, with an excised buccal fat pad, going over it multiple times with my FaceTite cannula to see how small I can make it. The second will be an anatomic explanation, or basically an anatomic recreation of the human face and why doing bipolar, such as FaceTite or AccuTite, buccal fat pad reduction is such a big mistake. So I hope you enjoy this film and the anatomic science behind it, and that it helps you better decide what is best for your facial rejuvenation and slimming goals. So this begs the question, is it even possible to do non-surgical buccal fat pad removal? In this case, using radiofrequency skin tightening. As you can see here, I'm using a FaceTite handpiece. That is a very powerful device, and the inner probe can get up to 160 to 170 degrees Fahrenheit. And when I do it, I definitely hear snaps and crackles and pops, and it's definitely killing fat cells. You can even hear the crackling. You can see how the fat is starting to contract a little bit. But this is an unrealistically direct contact with the buccal fat pad. If you're going to be doing it and exposing this much buccal fat, why don't you just cut it out in the first place? So the real question is, if you're going to do this without an incision through the cheek, as I've seen on some other YouTube videos, can you A, really know exactly where the buccal fat pad is? I don't think that's possible. And B, even if you were to spend as much time as I'm spending directly heating up the buccal fat pad, are you going to get as much instant contraction as you would get, for example, from removing the fat pad directly? So yeah, it works, yes, for killing fat, and yes, the body works by turning this into inflammation, which turns to collagenesis and contraction. But it's nowhere near as effective as actually just pulling out the fat pad itself, in some cases, which can only take like 5 to 10 minutes. Why would I spend 5 to 10 minutes cauterizing this tissue, taking a huge gamble, and relying on downstream contraction later, it's just not a feasible concept. It's not safe, and I wouldn't recommend it to anybody. So I've done this with the face-tight handpieces you can see here. I've done it with the AccuTite handpieces, and I've even done it with bipolar cautery on a very high setting. And yes, you can get tissue injury, you can get contraction. Look, it's maybe 2/3 the size of the original fat pad, but is it even close to worth it? The other question is a non-surgical method to treat buccal fat pad excess even safe? So this is the area that maybe you'd circle on the face. Let's peel off the layers of skin here, and you'll quickly recognize that underneath your skin you find a lot of important structures, including but not limited to the muscles of the inner mouth, including the buccinator muscle. You've got the SMAS, you've got the masseter muscle, you've got a lot of important muscles that help you chew and smile. Then you've got your buccal fat pad neatly sandwiched in between these things. And piercing that buccal fat pad is a salivary gland called your parotid duct. And then that's attached to a major salivary gland in your cheek. Above that, you have skin and you have fat. And between the skin and the muscle layers, you have both sensory and motor nerves. So really, would you want somebody to go through there and actually injure all these layers of tissue with this quote-unquote minimally invasive buccal fat pad reduction? I mean, if you're going underneath a fat pad and you're heating it up with this super hot probe, collateral injury will invariably occur to not only the deeper muscles of facial expression, but also to the muscles that help you chew, swallow, and smile. So I absolutely do not advocate doing this, and if you do it more superficially, you're not truly getting the buccal fat pad itself. So as you can see, if I were to perform a bipolar radiofrequency operation, not only would I have to estimate exactly where that buccal fat pad is in space and time. That's hard enough to do when you're doing an open buccal fat pad removal. But it would also have to go through multiple layers of tissue, including but not limited to the thick masseter muscle, nerves, salivary structures, and your skin. And so whether or not that energy can meaningfully go through those structures, if I were to hit a hole-in-one and get that probe right into multiple parts of the buccal fat pad without looking, you're going to put a lot of important structures in harm's way. So folks, minimally invasive surgery, I would almost say that buccal fat pad reduction in skilled hands qualifies as minimally invasive surgery. It's certainly scarless as far as the naked eye can see from anybody else. It's inside the mouth. And putting somebody's facial nerves and sensation at risk for the sake of a very subtle reduction in the midface is not warranted. I hope this helps and clarifies some of the anatomic confusion going on around the buccal fat pad. More and more I've been telling my patients that the buccal fat pad is a distinct structure from the subcutaneous fat. And that's an important distinction because it is true that removing subcutaneous fat makes you look gaunt and possibly can age you. But the buccal fat pad is a separate entity altogether and should be thought of as distinct from the subcutaneous tissues, the skin, and overall the facial skin envelope. I hope it helps. Bye. Oh, make sure to subscribe and thumbs up if you like this video, and I'll try to create more and more of them.